everyone, welcome back to another video. Today I am not in my room, I am actually at my apartment's clubhouse. I came here because I really need to focus and study for my pharmacology exam. Also, I want to apologize for this mess of a hair. I really kind of just tumbled out of bed and just came here like this. So I excuse myself. So yeah, I'm gonna be studying for pharmacology. I'm gonna be here for around, I wanna say like 5, maybe 6 hours, depending when I get hungry for dinner. Then I'm gonna leave. So yeah, I'm feeling kind of nervous about this test because it is the first exam we're gonna have. So I'm not really sure what to expect because a lot of people say that nursing school exams are way different and you have to study them like in a different type of way than your regular types of exams. So hopefully I do good on this exam because I was talking to an upperclassman and she was saying that the first test is usually the easiest test when it comes to pharmacology. That's why you need to do really good because the other tests are going to be super hard. So yeah, but you know, it is what it is. We got to get through this. We're going to study, we're going to get the information. So yeah guys, so this video is going to be a little bit boring because it's basically going to be me just studying, and y'all can like totally join in on a study session with me. I know other people kind of get motivated by watching people study. It kind of like puts them in the mood. So yeah guys, this is what we're gonna do. It's gonna be a studying with me type of video. I don't know how y'all guys are gonna react to it, but I hope y'all enjoy it. So yeah.
With hypocalcemia, so typically with one less than 9 or less than 8.4 or 8.5, that is called hypocalcemia. The reason that we have that is typically from chronic diarrhea, issues with pancreatitis, vitamin D deficiency, or malabsorption, This can also happen from a rapid infusion of blood transfusion. You'll learn about this more as you dive into things with parathyroids, thyroids, blood transfusions. You'll learn a little bit more about that. With this, you are going to see hypocalcemia. We're going to see twitches and tetany. So twitch, seize, and when I say seize, I'm saying seize because of like tetany. Twitch, seize, Shabbastics, and trousseaus. So the Shabbastics sign is elicited by tapping on the facial nerve, triggering a facial twitch, and a trousseau's sign is a hand and finger spasm with a sustained blood pressure cuff inflation. We can get numbness and tingling of the fingers and around the mouth. We can also get frequent and painful muscle spasms at rest that can progress to tetany. We can also have laryngospasms. So that is going to be a spasm of the larynx, which would cause breathing difficulty. And we can see seizures in the central nervous system. For a calcium level less than 9 in the laboratory values, we want the patient on electrocardiographic monitoring, just like with potassium. And the way we're going to treat this is administering oral or IV calcium supplements. And when we do this, we're going to watch very closely their respiratory status and their cardiovascular status. We can encourage dairy products, vitamin D, dark green vegetables, and when we are administering calcium, IV especially, we need emergency equipment on standby, which I would say is true for potassium as well, even though your reference doesn't seem to mention that in the one that I am reading currently. For hypercalcemia with a level greater than 10.5, the risks are from diuretics, like thiazide diuretics, increased calcium intake. There's quite a few things like bone cancer where we get bone breakdown, chronic immobility. So learning about the bone disorder drugs should kind of be should kind of assist you in some of these concepts. But as bone breaks down due to chronic immobility, because remember our body should be standing up 2/3 of the time, laying down 1/3 of the time. When we reverse that, our bones begin to break down because we're not putting weight on them. And so the bones say, well, why do I need to continually try and absorb calcium if you're not putting weight on me? I don't need to be strong anymore. There's some other things in there that can cause hypercalcemia, but you'll learn about those. This is a foundation over time. So now, as the opposite of hypocalcemia, you will see decreased reflexes. You'll still see dysrhythmias, but you're going to see weakness, confusion. You're going to see overall weakness instead of twitching and seizing like you saw in hypocalcemia. For the most part, the main diagnostic is going to be a calcium level greater than 10.5. The way we treat this is to increase the client's activity levels. So weight-bearing exercise, limit dietary calcium. We may encourage fluids to promote urinary excretion. We may implement safety precautions. We want to watch for pathologic fractures because this could just occur spontaneously. We want to monitor for blood clots because calcium does have a role in the coagulation cascade, and so it can actually put you at an increased risk for a blood clot. And remember some of the medications that we talked about with bone disorders that help drive calcium back into the bone, like your bisphosphonates, like some of the medications that are in your bone disorders will help drive that calcium back to where it's supposed to be. Last but not least, magnesium is typically found in the bones as well. It is in smaller amounts found within the cell and a very, very, very small amount found in the extracellular fluid, expected to be between 1.3 and 2.1. Hypomagnesemia, or too little magnesium, typically occurs when you have a lot of GI losses, diarrhea, or nasogastric suctioning. It's often associated with hypocalcemia. We'll see some of those come in pairs. It can also occur with malnutrition, laxative use, or alcohol disorders. When you see this, they have similar findings to hypocalcemia. So if you know hypocalcemia, you also know hypomagnesemia. So we could have a positive Schwastick's and Trousseau's. We could have tetany, we could have seizures. We could have hyperactive deep tendon reflexes, numbness and tingling, dysrhythmias, tachycardia, very similar to hypocalcemia. So what we will do is discontinue magnesium-losing medications like laxatives. We can administer oral or IV magnesium. We want to monitor deep tendon reflexes because remember, absent deep tendon reflexes would indicate that we've infused too much potassium. Encourage foods high in magnesium like whole grains, dark green vegetables, and we want to implement seizure precautions. We have hypermagnesemia. So again, if you understand hypercalcemia, you have similar findings. These typically occur with chronic kidney disease, acute kidney injury. This can, so you're wondering, now wait a minute, I just read that hypomagnesemia is caused by laxative use. If you take a lot of laxatives or antacids with magnesium, depending on how they're working in your body, it could cause hypermagnesemia. Again, here we're going to see diminished deep tendon reflexes. We're going to see they could be absent, muscle paralysis, shallow respirations. We're going to see cardiovascular changes. The EKG would need to be on our patient because we could have issues with our heart rhythm. And the way we would take care of this is to administer loop diuretics to help if the kidney function is adequate. We'd administer loop diuretics to help reverse the hypermagnesemia. So as you can see, sodium and potassium, I'd say sodium, potassium, and calcium are your biggest ones to really understand. If you understand calcium, you understand magnesium. And if you're taking notes, then I would, right next to calcium, that phosphorus has an indirect relationship with calcium. So if you have hypercalcemia, you have low phosphate. So low phosphate presents as hypercalcemia. If you have hypocalcemia, then you have too much phosphate. So you really don't need to understand phosphatemia. If you understand hyper and hypocalcemia, then you understand that if I have too much calcium, I have too little phosphate. If I have too little calcium, too much phosphate, too much calcium, too little phosphate. We will have some case studies in class, but if you have not prepared for this lecture, you will be lost. And there are about 8 to 10 questions that are dedicated to this on your exam, which is a solid 16 to 20 points. And so you need to make sure that you understand these very in depth, because again, you have now progressed through pharmacology, and we are now touching on one of the most difficult concepts in nursing that will be crucial to your understanding as you move forward in your nursing education.
RegisteredNurseRN.com, and in this video I'm going to be going over hypocalcemia. In the previous video I covered hypercalcemia. Now what I'm going to cover is I'm going to cover the signs and symptoms and give you a clever mnemonic to help you remember. I'm going to cover the causes and the nursing interventions, and I want to highlight for you things that you're going to need to know for your lecture exams and for the NCLEX exam. Now after this video, be sure to go to my website, registerednursern.com, and take the free quiz that's going to test you on hypocalcemia and hypercalcemia. In the description below, you can access that like to break them down because you have a lot of hypo and hyper, you have calcemia, natremia, everything like that. So we need to know what electrolyte we're talking about. Okay, hypo means underneath or beneath, so it's low. Cal, C-A-L-C, is the prefix for calcium. So we know that we're talking about the electrolyte calcium. And anemia means blood. So when you put all that together, what do you get? Your meaning is low calcium in the blood. Now, what is a normal calcium level? A normal level is 8.6 to 10 milligrams per deciliter, and anything less than 8.6 milligrams per deciliter is considered hypocalcemia. What is the role of calcium? Because in order for you to understand the causes and the signs and symptoms, you need to know how calcium works on the body and how it affects everything. Okay, it plays a huge role in your bone and your teeth, health, your muscles and your nerves, cell function, and blood clotting. And whenever the calcium level messes up, these areas in the body start messing up. Now, also, how come a person would get hypocalcemia? Well, let's look and see how the body absorbs it. It's absorbed in your GI system. So if you have any problems with malabsorption like celiacs or Crohn's or anything like that, you're probably going to have a low calcium level because that's where calcium's absorbed. It's stored in your bones, so if you have low calcium level, it's in your bones, you're more at risk for bone fracture. So you really got to watch safety with these patients. And it's excreted in your kidneys. So kidneys play a huge role in getting rid of calcium. So if you have some renal issues, the kidneys may all of a sudden just start excreting too much calcium, and then you're going to have low calcium. So that right there helps you understand how it plays, and you're going to understand more about the signs and symptoms. Now also, another thing, vitamin D helps calcium in absorbing calcium in the body. So remember that, because vitamin D and calcium are friends and they help each other out. Now, calcium and phosphorus, I want to put this as a side note because it's part of one of the causes. They affect each other in opposite ways. I remember in nursing school, I remembered it like calcium and phosphorus were sisters, but they competed in everything and they did the opposite of everything. Because whenever your calcium level goes high, your phosphorus level will go down, or vice versa. So you all want to remember that. Okay, let's talk about the causes of hypocalcemia. I think one of the best ways to help you remember all these causes is to develop a mnemonic. So this mnemonic that we have here is remember the word low calcium. And each letter in this word is going to represent a cause. It's really important, I suggest you write this down if you're preparing for a test, because a lot of your professors are going to give you a scenario and maybe throw out, this patient has a low parathyroid hormone. What are they at risk for? And you have all these options for hypocalcemia, hypercalcemia, or maybe hypernatremia, and things like that. So you need to remember the causes. Okay, so let's get started. Okay, L for the first letter. Low parathyroid hormone. Your parathyroid plays a huge role in calcium. And if you ever have destruction or removal of this parathyroid or any type of neck surgeries or a thyroid, writing's not that easy, but remember. Decreasing, and this is a huge test question. So anytime a teacher throws out at you a patient's had neck surgery or they had their thyroid removed, think calcium level, because parathyroid hormone plays a huge role in regulating the calcium. And you're also going to see that in hypercalcemia. You're actually going to be seeing the calcium level going high because it's going to be a high parathyroid hormone, which I talk about in the other video. Okay, O for oral intake inadequate. This is seen mainly in patients who aren't taking enough calcium in. For instance, patients who have alcoholism, maybe bulimia, things like that. W for wound drainage, especially the GI system, because remember, it comes back to calcium being absorbed in the GI system. So if you are losing a lot of wound drainage, say you have a wound back on a on the intestines or in the belly or something like that, they're at risk for losing calcium. So that's one. C for celiac disease and Crohn's disease. That is back to the malabsorption because their villi and everything in their stomach is messed up, so they're not absorbing those electrolytes that they should. So they're at risk for that. A for acute pancreatitis. L for low vitamin D intake. Remember, vitamin D, as I pointed out at the beginning, allows calcium to be reabsorbed. So if you don't have a lot of vitamin D, the body's not going to intake the calcium. And that's a lot of times why physicians like to prescribe calcium and vitamin D together because they help each other. The other C for chronic kidney disease. If the kidneys aren't working properly, they can excrete too much calcium and waste it. So that will come back and give them a low calcium level. I for increased phosphorus level. If they have high phos levels in their blood, remember calcium and phosphorus are sisters and they like to do the opposite. So you're going to have a low calcium level. U for using medications such as magnesium supplements. If the patient already has a low calcium level and they take magnesium, it can drop them even more. Any types of laxatives, loop diuretics, and calcium binder drugs. And then M for mobility issues. They're not getting up, they're not moving around, they're not using that calcium, bones aren't getting the exercise that they need, and it throws everything off. So now let's talk about the signs and symptoms of hypocalcemia. For the signs and symptoms, try to remember the word cramps. Each letter correlating with either a sign or a symptom. Okay, the first one, C, confusion. Patients with low calcium levels are going to have confusion. R, reflexes are going to be hyperactive. If you use the hammer and hit on those deep tendon reflexes, you're going to notice that they're really reactive. A, arrhythmias. This is a really big test question. You may see prolonged QT intervals. That's really the big one that they like to hit on in exams. They're going to say, patient has a calcium level of 7.3. Which of the following is indicative of an EKG change? And the option is either prolonged QT interval or prolonged ST interval. So remember that one. M for muscle spasms in the calves/feet. You can have seizures as well. P for a positive Trousseau's sign. This is big, so commit this to memory because this and Chavatsky's is what a lot of professors in NCLEX likes to test you on, because anything that's like a sign or a positive this, positive that, that's a lot of a test question. So what is a Trousseau sign? Okay, usually this is going to present before Chavatsky's sign. And how you initiate this response is that you put a blood pressure cuff on the upper arm, just like how you're going to take a normal blood pressure, and you're going to inflate the cuff above the patient's systolic, a little bit greater than what it is, and you're going to hold it there nice and tight for 3 minutes. And then what you're looking for while that cuff is on the patient's arm, you're watching their hand. And all of a sudden, the patient, after 3 minutes, will involuntarily, their hand will start just crunching, sort of flexing like this, and they can't really control it at all. And if you see that sign of that reflexing of that, that is a positive Trousseau sign. Okay, next is the sign of the Chavatsky's. This is where you have hyperexcitability of your facial nerve. And to initiate that, what you do is you tap on the jaw. There's a muscle right there called the masseter, and you hit on that, and what happens on that affected side that you hit at the angle of the jaw, you will see either the lips twitch towards that side or the nose twitch. So that is a positive Chavatsky sign. So remember how you would do that, because it may ask you how you perform that, or you've seen the patient do that, so what is it showing? So make sure you commit that to memory. Now let's talk about the nursing interventions, things that you would do for this patient as the nurse. Now this is, again, where teachers love to hit on for exam questions and on the NCLEX, because NCLEX loves to know, what are you going to do as the nurse? Okay, number one, say
your writing matters.
a low calcium level, if they fall, anything like that, they are at a huge risk for a bone fracture. So make sure you're doing everything you can to prevent bone fractures, and also that you're watching out for laryngeal spasms, because this can happen if the calcium level is really low. Next, the doctor may order for you to administer IV calcium, usually 10% calcium gluconate. Some things you need to know about this is that you give it slowly according to the instructions. You need to monitor their heart rhythm, have them on a bedside monitor. Watch for any infiltration or phlebitis, because this is really hard on the veins. And if it infiltrates or anything like that, you can have tissue sloughing. Next, it's really best to give this through a central line, but look at your hospital protocol. You want to use that or a really big vein. And if the patient is on the medication digoxin, you want to watch this as well. Sometimes physicians won't even order this if they are on dig, but sometimes they will. And because it can cause dig toxicity. So remember that as well. Calcium, 10% calcium gluconate and dig don't go well together. Okay, next, the doctor may order you to administer a oral form of calcium with vitamin D supplement. Remember, vitamin D and calcium like to go together. And you would give this after a meal, because remember, calcium is absorbed in the GI system. You want to make sure that there's some food on the stomach, or at bedtime with a full glass of water. Also, if the patient has a high phos level, remember, phosphorus and calcium like to do opposite. So if their phos level is high, in order to get the calcium level to come up, the physician may order medications like Tums, which are aluminum hydroxide sodium, to increase that level. And you're going to encourage foods rich in calcium. Another big thing that tests like to hit on, they'll give you a selection of food and which one would be best for that patient to eat. So I've developed this little saying to help you remember it. And remember this saying, each letter correlates with what is rich in calcium. So remember, young.
Okay, so I just wanted to make this study with me video kind of long, but not too long, just depending on how y'all react to it. Then we might make it longer. But yeah, guys, today has been quite a day. I'm already tired, but I still have to continue studying. I'll probably go home, get something to eat, and go to the store and buy some like materials that I need. So yeah, thank you guys for watching today's video. I love y'all guys so much. So yeah, guys, adios.